We are back with Dr. Dixon with Cone Health, and in the spirit of April Fool's Day, we're debunking some common health myths. Okay, so this is one of them. A lot of people think for aches and pains, it's better to wait and see if it gets a little bit better before seeking appropriate care. Why is that a myth?
Well, there are certain symptoms that you should ignore or delay seeking care for. Chest pain, for example, acute onset shortness of breath. If you have any numbness or weakness in your arms or your legs, facial droop, any acute changes to your vision, those could represent things like a stroke, a heart attack, even a blood clot in your lungs, a pulmonary embolism. And at that point, the adage is time is tissue. And so delaying care could result in a worse outcome for you. Now, certainly if you have a sore muscle or something and you want to give it a couple days, sure, but don't ignore those big symptoms. And my general thought is if it's interfering your quality of life, seek care. That's what we're here for.
Gotcha. Okay. Another myth, if you're not having any symptoms, you probably don't need to worry about any kind of cancer screening.
I hear this one a lot, and I can't stress enough the importance of early detection. For me in primary care, the cancer screenings I discuss most often are colon cancer, breast cancer, and lung cancer. And for those three types of cancer specifically, oftentimes if you're having symptoms, it could represent that there is something going on that's in an advanced stage and it's much more difficult to treat. It's a lot more treatable, a lot more preventable to a degree if you are staying up to date on those screening guidelines. So going back to one of the first myths about if I'm feeling fine, I don't have any symptoms, I don't need a primary care doctor. Again, that's part of what we're here for, is to make sure that you're staying up to date with those age-appropriate cancer screenings.
Yeah, and that definitely hits close to home here at WFMY News 2. Our own Julie Luck got a preventative colonoscopy and found out that she had colon cancer. And so thankfully it was found early. We were able to take care of it, and she is a cancer survivor. So we get that here for sure. All right, another myth, food packaging that says all natural, low fat, organic. Those have to be healthy options.
You would think. I think there's a couple important things to remember about the food marketing industry. Number one, they're trying to sell more of their product. And in order to do so, oftentimes they are going for the minimum requirements as it relates to food labeling. So you mentioned all natural. That doesn't necessarily mean anything from an FDA standpoint. It's put on there to make people assume that their products are free of certain chemicals, things like that, but it really doesn't mean anything. To that same respect, low carb or light options, there's not really a defined meaning for those terms, and so you could put them on virtually everything. There are certain terms that do have stricter guidelines, like gluten-free, for example. The same with low fat. It does have a minimum or a maximum fat content requirement. Organic is another claim that we see a lot. That restriction is related to certain pesticides or chemicals they can put on the food, but it doesn't necessarily equate that the product overall is healthier for you. So you certainly have to not trust everything that you read on food labels.
For sure. Okay. Some people also believe that vaccines are just for kids, that once you get to be an adult, you don't need a vaccine anymore. Why is that false?
Well, there are vaccine guidelines that are for patients well into their 70s, 80s. Things like pneumonia vaccines, RSV, the shingles vaccine. We give patients flu vaccines every year at all ages, so it's not just children that need vaccinations routinely. There are plenty of vaccines that are indicated for adults as well.
Mm-hmm. All right, we've got about like 30-ish seconds or so. Final thoughts on what we should not be fooled about when it comes to our health?
Well, I think in general, just view wellness as more of a destination, not a destination, but more of a lifestyle. You can't expect to make just several changes at once and make it sustainable. It's something you need to gradually chip away at. If you want to focus on exercise and then work on your diet, that's fine. It's a gradual process and something you have to continually work on. And that's what we're here for in primary care.
Yeah, lifestyle, not just for a short amount of time to fit into some kind of outfit or whatever.
That's right.
All right. We thank you for your time and your expertise. We appreciate this. If you missed any of this, maybe you want to send it to a friend. It's going to be in the To Your Wellbeing section of our website.